Hello everybody and welcome to my YouTube channel. This is Dr. Mridula V Amarnath here. So I'm sure all of you must have heard about jaundice, and you must have the first thing that comes to your mind is jaundice, usually in adults. But no, jaundice can also occur in newborn babies. So today I'm going to talk to you about what exactly is neonatal jaundice, or what we call as jaundice in newborn babies. Why does it happen? And what are the different symptoms that when it happens, what are the different symptoms that we look out for? And how do we treat it? And more importantly, how can we prevent it from happening in the first place? So stay tuned to know more. So what exactly is this neonatal jaundice? It is nothing but the yellowish discoloration of the baby's skin and the baby's sclera, that is the whitish color part of the baby's eyes. So normally we have this pigment called as bilirubin. And this is produced during the breakdown of these red blood cells inside our body. So now in older babies, what happens is the liver is quite mature enough and it can process this bilirubin and remove it out from our human system. Okay. But in young newborn babies, what happens is the liver is still not mature enough to function. So as a result, it does not completely eliminate the bilirubin from the body. So and hence the body has a high level of bilirubin pigment inside the body. And now this can cause the yellowish discoloration. See, the good news is in most of the cases, this neonatal jaundice slowly starts disappearing, say within 2 to 3 weeks. Okay, now as this liver slowly starts developing and when the baby starts feeding on the mother's milk, the bilirubin slowly starts getting excreted from the baby's body. But if the jaundice persists for more than 3 weeks, then it is a matter of concern, because then it indicates that there is some underlying pathology which is responsible for this jaundice. The American Academy of Pediatrics recommends that all newborn babies should be examined for jaundice before discharge from the hospital, and again when the baby is between 3 and 5 days old. So next I'm going to talk to you about what are the most common causes of neonatal jaundice. Premature babies, babies who are born before 37 weeks of gestation, babies who aren't getting enough breast milk or formula, either because they're having a hard time feeding or because their mother's milk isn't in yet, or babies whose blood type isn't compatible with the blood type of their mother. So what happens is when the baby's blood type does not match with the mother's blood type, there is a buildup in the antibody cells. Okay, now this can cause a destruction of their own red blood cells, and this can eventually lead to a sudden increase in the bilirubin levels. So the other causes of newborn jaundice include bruising at birth or other internal bleeding, liver problems, an infection, enzyme deficiency, or an abnormality in your baby's red blood cells. So next I'm going to talk to you about what are the most common symptoms that you will notice in a baby having jaundice. So the first sign of jaundice is a yellowish discoloration of the baby's skin and eye. Now the yellowish discoloration usually begins within 2 to 4 days after birth and may start in the face before spreading across the body. The bilirubin level typically peaks between 3 to 7 days after birth. So like I said, jaundice in newborn babies is very common. There is nothing that we need to be really worried or concerned about. But if the jaundice persists for a longer duration, that means that there is some underlying pathology which is responsible for this kind of jaundice. Now severe cases of jaundice should be, we should be extremely careful, because sometimes the bilirubin can actually spread to the brain and then it can cause a permanent brain damage. So that is quite a risky situation. So as a parent or as a caretaker, how would you know whether is your baby improving or is your baby's conditioning worsening? Well, just to check out for these couple of symptoms. If you notice that the jaundice spreads or becomes more intense, or if your baby develops a fever over 100 degrees Fahrenheit, or if your baby's yellow color starts deepening, or if you feel that your baby is feeding poorly and appears very lethargic and makes high-pitched cries, then it's the time that you really need to be concerned about. So how is this jaundice in newborn babies diagnosed? So generally most hospitals, they discharge both the mother as well as the baby within 72 hours after delivery. But it is important that you bring your baby back again for checkup, because like I said, the bilirubin level usually peaks up between the 3rd to the 7th day post-delivery. A distinct yellow coloring confirms that the baby has jaundice, but additional tests may be required to determine the severity of the jaundice. Babies who develop jaundice in the first 24 hours of life have their bilirubin levels measured immediately. Now, this could be done either through a skin test or a blood test. Along with that, other tests like a complete blood count, the blood type, and the rhesus factor incompatibility is also done. This is basically done to rule out if there is an underlying condition that is responsible for this jaundice. So how is this neonatal jaundice treated? So like I said, in most cases, the jaundice subsides on its own, because as the baby develops, the liver slowly starts getting matured and it is able to eliminate the excess bilirubin from the body. But simultaneously, it is important that the mother feeds the baby at least 8 to 12 times in a day, which can also help in the elimination of the bilirubin. But in severe cases, they have something called as phototherapy. Like as the name suggests, photo, that is, light is being used to eliminate the excess bilirubin from the baby's body. So in phototherapy, the baby is placed on a special bed under a blue spectrum light while wearing only a diaper and special protective goggles. A fiber optic blanket may also be placed underneath your baby. But in severe cases, what we do is a process called as exchange transfusion, where the baby receives blood from a donor. So during this process, there is a replacement of the baby's damaged blood cells with healthy red blood cells. So now this way, this increases the baby's red blood cell count and also reduces the bilirubin levels. So the next and the most important question is, can newborn jaundice be prevented? So during pregnancy, you can get your blood type tested, and after the birth of your baby, the baby's blood type can also be tested. Now this is basically to rule out if there is any incompatibility between the mother's and the baby's blood, which can be a cause for the neonatal jaundice. Make sure your baby is getting enough nutrition through breast milk. Feeding your baby at least, like I said, 8 to 12 times a day for the first several days ensures that your baby isn't dehydrated, and it also helps to eliminate the excess bilirubin from the body quickly. Now say in case if you're not breastfeeding your baby, at least give your baby formula milk. So give the baby at least 1 to 2 ounces of formula every 2 to 3 hours for the first week. Now preterm or smaller babies, like we know, you generally take smaller amounts of formula milk. So I'll conclude by giving you a small little tip or trick. Okay, so how do you examine whether if your baby has jaundice or not if you're at home? So take your baby out to natural daylight and pinch a small part of their skin, either the forehead or the tip of their nose, delicately, and leave it. Now if you notice that the skin still appears yellowish, if there's still a yellowish discoloration of the skin, that means the baby has mild jaundice. But if there is no such yellowish discoloration and the skin appears slightly lighter in color, that means the baby does not have jaundice. So like I said, there's nothing to really worry about neonatal jaundice, but if it persists for a longer duration, then we must be concerned about it and immediately should do the necessary blood tests and try and figure out what the underlying pathology is, so that we can start the treatment as early as possible. Thank you.